All right. Hello, everybody. We're jumping in. We're going to start with our heart health talk. And so tonight is all about really just how do we take care of our heart, not necessarily react to it, but have a healthy heart and a healthy body. And we're in the midst of a time where there's a lot of fear about health and sickness and death. And it's just a reminder that your health is one of the most valuable assets you've ever been given, and you're responsible for it. You've been given responsibility for your health. So the better you understand and the more you know, the better you do. And so it's just a good reminder of that. But the reality is we're talking, thousands of people that are dying from a virus, and that's a terrible thing. Yet at the same time, heart disease is still the one of the leading causes of death from disease, and it has been consistently for decades. Where we're talking close to 1 million Americans will die this year from heart disease, and it's a disease that's largely preventable. And we lifestyle ourselves into it, and we can also lifestyle ourselves out of so much of it. And so the goal will be that tonight that this could be empowering for you and encouraging for you. And so we're going to walk through a handful of things. If you have questions, put them in the comment. I'll do my best to respond. But as we go from there, just heart health, we want to talk about, again, how do we take good care of your heart? And this image here that I want to show you is really powerful. So if you looked at it and you have a system, let's say, for example, you have a system that's designed to produce something. So for example, in a car dealership, they might have a system that's going to produce a car. So the end result would be the car. Now, when we're talking health, if you have a healthcare system, wouldn't you want that system to produce health? And that would be ideal, that whatever you're doing to take care of your health, that the end result is you're getting the outcome you want. And so many people mistaken the idea that we have a healthcare system, and we don't. We have hospitals and clinics and doctors that are very, very good at helping you in crisis. And thank God for the hospitals. Thank God for the emergency rooms, the surgeries, the ability to keep a person alive. But that's there to keep you alive in crisis. We don't have a system really nationally to keep people healthy and well. And that's something that's worth talking about. And so what I want to read to you is this. This is Dr. Dennis Cortez, medical doctor and Mayo Clinic's president and chief executive officer. And he had the following to say in a recent interview, quote, "To the extent that people say our healthcare system is broken, I would reject that as too simple a thought. There is no system, so let's design one. The fatal problem that all of our people in Washington have, and many people have in our country, they've come to believe that the system is broken. That's like saying, I've got a broken car, and you're going to go and you're going to fix it. And you go into the garage and you find out, oh, I forgot, I don't have a car. You can't fix something that doesn't exist. Nobody ever designed this to be a system. Nobody ever sat down and said, here's where we want to be in the future. And the reason I share that is this. We have a system that's designed to respond to emergency, and that's designed to help you in a crisis. And they will, and they do a very good job of that. But we don't have a system that's designed to keep you healthy. And that's something for us to really look at and say, well, what is your system then? Because the main person that's responsible for your health is you. It's not a doctor or a hospital or an insurance company. You're responsible for your health. So what then is your system? And that's what we want to look at. And so within Max Living and doctors across the nation, we've created this system called the 5 Essentials. And it's really looking at a human body and saying, how do we produce health consistently? Now, in crisis, we still may need to use the hospitals and the doctors and use them in those emergency scenarios. But how do we produce health? And really, the 5 Essentials were designed by doctors saying, how do I keep myself healthy and my family as healthy as I absolutely can? What are the things that I can do, and what can I focus on to get predictable outcomes? And that's what they created. And then from there, they said, well, let's just start teaching our patients this. And so what you see here is you've got these 5 major areas. If you can focus on those areas and advance in them, you're going to consistently produce health in a person. And so the first one, it says core chiropractic, because for your body to be healthy physically, the nerves have to work right. It's your brain that communicates life down the spine and out the nerves. And that tells your heart to beat and your lungs to breathe and your body to digest and heal and regenerate and repair. The nerves communicate life to the tissue. So if you want to have a healthy body, you must have a healthy nervous system. So it's just recognizing that and saying, well, how do we take care of it? That's why chiropractic is part of it. The other one is nutrition, is making sure that you're getting nutrients and the fuel that your body needs to thrive. And then mindset is understanding health, having a good mindset as far as relationships, faith, a peace of mind. I tell you what, you can do all these other things right. If you are stressed to the max, or if you don't have peace, you will struggle in your health. And many of you have seen that season. You lose a family member, you go through a stressful situation, and you try to do these other things right. You eat well, you exercise, you're getting adjusted, you're doing your home care. If your mindset is not at peace, it's really hard to recover. So we've got to address that. We can't just pretend it doesn't exist. And then their oxygen is really movement and exercise and oxygen. Oxygen is a nutrient that our bodies need to survive, and the best way we get it is through movement. And when you start doing things where you breathe heavy, where you work up a little bit of a sweat, that's where you're really getting oxygen into your cells. And then lastly, we live in a world where we have a lot of chemicals and toxins that we're not supposed to be around, or we weren't designed to be around, and we have to deal with that. How do we minimize that exposure? You can never fully get rid of it, but if you can minimize it, you're going to do significantly better. And what we find is this is what we find across the nation. When people live this way, they get better. This is how I got off of 7 medications in 3.5 months. This is how I see people get off of medications. This is how I see them live a better life, a higher quality of life, is we start applying these essentials. This becomes a system and an approach that you can consistently use for more predictable outcomes, to have better health. And it doesn't mean that you don't ever need a surgery, or it doesn't mean that you don't ever need a medical doctor, because you may, and thank God they're there because they're good at what they do. It means this is your primary system for health. And then if you need an orthopedist, if you need a physical therapist, if you need a medical doctor, if you need a pharmacist, if you need one of those people to help you, they will. But that's in response to a crisis or a major problem. It's not your primary system. So this becomes your system and your way of living. And I tell you what, I've been living this way for almost 13 years now, and I've never regretted it. It's been a constant blessing to my life, and I see it with so many of our patients. So if you can take one thing away from this, it's just asking yourself really honestly, what is my system of health? And do I like that system? Am I happy with it? Does it need to improve? Does it need to go away? Do I need to get a better one? What is your system, and are you happy with it? If you can answer that question, you're going to do a lot better. You're going to take away a lot from this. But the 5 essentials for sure is a system that we know that you can use. Now, yes, there are specific things that different people do differently based on their situation? Of course, but this is a thing that is designed to help the human body thrive and really do well. And if you have that mindset stepping into heart health, you're going to do a lot better. A lot better. And that's what we want to see improve. So when it comes to heart disease, the reality is this, is we live in a culture where 1 out of 2 people will develop heart disease. And so it's 48% of Americans, and that's including children. They're seeing plaque and development in young children already. Heart disease is thought to be normal with aging. That's not true. It's common, but common is not normal. And I'm going to read through a quote later on from one of the founders of modern cardiology, and he's going to, and I'll prove that to you. But 1 out of 2 is what we're seeing. So if it's not you, it's your spouse. If it's not your spouse, it's you. If it's not the 2 of you, it might be your kids. And so the reality is that if we're seeing this younger and younger, a question I had with the team, we were sitting around talking about this, is at what point is it a good time to start doing the right things to take care of your heart? Because so many people that get to their late 50s, their early 60s, and they're already having issues, some people even younger, unfortunately, where they're having major issues with their heart. And the question is, well, when should they have started? When could they have started doing things different to improve? And for sure, you could say, yeah, right now they can make changes and it will help. And it will. It definitely will. But if they were to avoid all of this, when should they have started? It's really as a child. They should have started young. And so if you haven't started making these changes and making these habits a normal routine for you years ago, then now is the time to start and just continue to advance there. But it's 1 out of 2, and we want to do a better job. And so for me, a great way to imagine taking care of my heart, or taking care of my body, and specifically the heart, is looking at a home. And if you think of your heart like a home, it's how do you take care of and how do you manage your home? It might need regular repair, where you have somebody come and do the shingles, you have somebody come work on the windows, you have somebody come and paint the siding, you have somebody come and fix the door, work on the garage door. There's different like regular maintenance that you would do to a house if you want it to last a really, really long time. And the same thing is true for your body. If you continue to do regular maintenance for your body, you're designed to live 80 to 120 years of great health, that you would thrive. That you wouldn't be in a nursing home needing somebody else to take care of you, but you could thrive for years and years and years. Yet we're seeing where there's a waiting list for the nursing home. And so something's obviously going wrong there. But we know if we can take care of the house consistently, it will last longer. It can do a lot better. And you've all seen that, where somebody had like an old Victorian home that they really took care of it, and it's in a pristine condition. It's awesome. And then you see like where there's an old Victorian home where it was beautiful and now you don't even want to go near it because it would be such a project, it wouldn't even hardly be worth fixing up, right? And then when you look at your body, what type of home are you? How have you really been taking care of yourself? And that's what we want to see with the heart. Because the reality is if we let the house just deteriorate and we wait for crisis, now we have to call in our emergency help. So for example, if you just let your house continue to deteriorate, the house, the wiring, everything, you get water damage, you get leaks, you get poor wiring, everything else, eventually you can find yourself in a scenario where now you have major crisis. And there's nothing in this scenario that a repairman is going to do to fix this. To me, this is the idea of like bypass surgery. It's like now you're in a major crisis where someone has to rip open your chest just to keep you alive because things have gotten so bad, right? It didn't happen that way on accident. It's built up to the point where this was able to happen. Now you can obviously, this analogy only goes so far, but just the thought of the image of it to me is powerful. And what happens is now in this scenario, you have to call in the firemen, and they're designed to save you in emergency. They can knock down the door. They can axe down a wall or whatever they need to do to get you out. And that's essentially what open heart surgery can be. That's what it looks like there. That image on the right is where they actually crack open your chest, pry it open, they have to get into your heart. And it's a very, very, it's a tough surgery to be done. And thank God we can do it because it can save a life, but it's not ideal. It's not ideal that that's the first line of response. In emergency, use it, but it's not ideal. What if you were taught to take better care of yourself where you never had to end up in that scenario? Where most homes don't need the firemen to come in to keep them going, to put out the flames. Most don't. What if people were like that, where we didn't need the medical system to save us time and time and time again because we had such better health? And that's really where, if we can approach this with a better system, we can have a significantly better outcome. And that's what we want to see. And that's the goal of the webinars, that gets you to think and really take what you've learned there and say, okay, how do we approach this differently? Because our medical system is really designed to react, and it's designed for emergencies, where the 5 essentials is designed to produce health and longevity. So very different things, but you be the judge as far as how do you want to approach this? What do you want to do with this? So when we're talking about taking care of the heart, we have to understand certain things. So what is cholesterol? Cholesterol is a soft, waxy substance that's made by the liver. The majority of it is made by the liver. It's needed to manufacture hormones, bile acid, vitamin D. You cannot make estrogen, testosterone, cortisol, and a host of other vitamins without cholesterol. So here's a few things that I've written down that cholesterol is necessary for. You need cholesterol for your testosterone. So if a person has low T or low energy, if their cholesterol levels are low, their testosterone levels are going to go low too. Alzheimer's and dementia are directly linked with low cholesterol, progesterone, estrogen, cortisol. So again, that's going to play a part in energy. Cortisol levels are going to be affected by your cholesterol because you need cholesterol to make cortisol and to respond to stress. So if a person has a life that's high in sugar, lots of caffeine or regular caffeine, which regular to me is 1 cup a day, chemicals, lack of sleep, chronic stress, that person is going to need more cholesterol to make more cortisol to respond to that stress. Aldosterone, the follicular cells in your thyroid. So cells in your thyroid that actually are responsible for producing hormones are made with cholesterol. Vitamin D, and then cholesterol is secreted from the liver. It actually helps you digest food and break down food. So it's wildly important for you to be healthy. And so a lot of times you hear about good cholesterol, bad cholesterol. Well, the reality is it's all good. It's just when it's LDL cholesterol or VLDL cholesterol, that's where it's more vulnerable to create plaque. But it's all good. It all has its purpose. It's just in what environment is your body and how can your body use cholesterol? The best way that I like to think about it, I like to think of cholesterol as a repairman. If your house had hail damage, you don't call the fireman to come and replace some lost shingles or to replace the windows. You call a repairman. And they come in, they can fix the window, they can fix the siding, they can fix the roof, and they can help your home last longer and prevent water damage and warm, cold, that type of thing. Just really easy analogy to understand. A repairman comes and fixes things. Well, cholesterol is a repairman that your body and your liver creates to go and fix things. So your body will send cholesterol to different areas of the body to help it heal. Now, the challenging part is if you have a repairman come out at the beginning of May because you had storm damage, and then you have a repairman come out at the middle of May, and then the end of May, and then the beginning of June, and the middle of June, it's kind of weird to say, why does the repairman keep showing up? What's going wrong that you keep needing repairs? And what they find is when people consistently have high levels of cholesterol, it's concerning because you're saying, why do you keep needing repair? What's going on? And that's really a symptom that there's a lot of damage Not necessarily that cholesterol is bad. Cholesterol is a response to damage. And really, if we were wise about it, we'd be saying, what's the root cause? How do we address the underlying cause instead of just trying to fire the repairman? Because if you do that, it doesn't make the house last longer or your body last longer. You'd say, well, we need them, but let's just stop damaging this so we don't need so many repairmen. Well, we need cholesterol. Let's not just stop our bodies from producing it or get rid of it completely. Let's understand, why is your body creating it in the first place? Because it's actually a good thing. It's the right response to inflammation and sickness and disease. And one of the best cardiologists in the world, his name's Dr. Jack Wolfson. Many consider him to be the best in the world. What he says is this: is cholesterol. One is it's seen that people have higher levels of cholesterol have better memory, because there's so much cholesterol in your brain. And the other thing he said is, quote, "I start to search for cancer in my patients with cholesterol less than 150, end quote. So if you get too low, there's a concern for major disease as well. So just remember, cholesterol is a good thing. And one of the best ways to get nutrients to produce the right cholesterol is eating animal products. So your animal products are going to give you the nutrients that you need to create cholesterol. So just remember that as well. Does cholesterol cause heart disease? The truth is, it is oxidation of cholesterol that causes heart disease. Oxidation is essentially like, if you think of an apple, you cut an apple in half, you leave it outside in the sun, it goes from more of like a white looking color to a brown. That's oxidation. It starts to deteriorate. Or same thing as rust on a vehicle. Oxidation of cholesterol is what causes heart disease and plaque. Just the cholesterol itself won't do that. More people have heart attacks with normal levels of cholesterol than elevated. There's multiple studies that have shown that. There's a higher death rate with low cholesterol than high cholesterol. Statin drugs or cholesterol-lowering drugs have not been shown to affect the mortality. So the reality is they'll lower the number, but it doesn't necessarily mean they prevent you from dying from heart attack or stroke. So that's interesting too. So cholesterol is a good thing, but we do not want to oxidize it. And that's what we want to talk about tonight. So as we move on, the dangers of cholesterol medications: they damage the liver because they essentially shut down the liver. They damage nerves because your nerves need cholesterol. They cause joint pain, ligament issues, muscle wasting, and atrophy, so your muscles shrink. Heart failure, which I thought was really interesting, because the heart is a muscle, but it actually is a side effect of cholesterol medications. Limits a person against cancer, can lead to depression, stops CoQ10 production. If a person's taking cholesterol medications, they should be taking CoQ10. It's just a standard. Everybody should really be doing that. But yeah, there's multiple research articles that have talked about people with low levels of cholesterol have higher heart attacks than people with normal or even slightly elevated. So this idea that you have to be scared of cholesterol, that's not totally true. You just want to understand it. It's the repairman. Why are they repairing? Let's get our bodies healthy. From there, as we move on, dangers of cholesterol medication: statin drugs work by inhibiting enzymes that manufacture cholesterol in the liver, basically shutting down part of your liver. The problem is, cholesterol is needed for all those hormones, like we talked about: testosterone, progesterone, estrogen, cortisol, follicular cells, vitamin D, and then 60% of the brain tissue is made up of cholesterol. So if you're constantly lowering this healthy thing that our bodies need for brain and nerve function, it's going to affect your brain. It's just a matter of time. So if you lower cholesterol drugs, the brain and nerve tissue begin to deteriorate. You block serotonin uptake sites, which decreases serotonin and can cause depression. And then again, it talks about CoQ10, which helps transfer energy. If you're on cholesterol-lowering medication, really you should supplement with CoQ10. If you ask your doctor, they'll probably tell you to take it. They don't always just tell you when they give it to you. Now, again, I don't prescribe cholesterol medication, so I'm not probably the first person you should be asking about all this. I'm the person that you should be asking about, what's my system to get healthy? But I just want you to be aware of these things. Now, as we move on here, should I lower my cholesterol? I thought this was interesting. Every symptom in the body is doing the right thing at the right time. Here's a quote from an MD. He says, quote, "In other words, it has never been conclusively shown that lowering cholesterol saves lives. In fact, several large studies have shown that lowering cholesterol into the range currently recommended is correlated with an increased risk of death, especially of cancers." So cholesterol is needed for a healthy body. So if we really want great health, we want to use cholesterol what it's for, but then understand, why does it go haywire? And so we're going to jump into that here in just a second. But what I want to share with you, I thought was really interesting. So this is a thing: if you're taking any sort of medication, it's worth looking into what they call the NNT. And so normally you don't hear about this, but the NNT is what's called the number needed to treat. So when they create a medication, they'll say, how many people need to take this drug for it to actually have the desired result? And you can take a specific medication, so anything that you're on, you can actually just look it up and just Google number needed to treat, type in the specific name of your medication, it can tell you. But if you're just like generically saying, like, what would be a generic idea of a number needed to treat for like an antidepressant? So essentially the NNT for that would be 12. So they're saying if 12 people take an antidepressant, we'll get the desired result in one person. How many? So here's what I wrote down. The NNT is the number of patients you need to treat to prevent one bad outcome. So how many people need to do this before you prevent one bad outcome? So 12 people with antidepressants. When they come to statin drugs or cholesterol lowering medications, the NNT is about 104, and it's different for different medications and actually different for different age classes. So it's actually quite a bit higher if it's a person in their 50s versus a person in their 60s. And then if you look at blood pressure lowering medications, the number needed to treat for the desired outcome is actually 101 in 125. So I just want you to be aware of, don't put all of your faith in the medication. If you're using it to help treat a situation, okay, but that doesn't absolve you from not taking care of your body. Then take the medication as prescribed, work with your doctor, but then get your tail doing those things that you need to do to get healthy. Start living those essentials. Take care of your body. This idea that you're getting away with it, it doesn't work. Okay, just if you're saying I'm getting away with it, you're likely lying to yourself. Okay, do what it takes to get well and really just start creating habits. So now we look into this high blood pressure. It's a warning. High blood pressure is a warning sign. Increased blood pressure is the indication that there is thickening or blocking of the arteries. This can be caused by platelets in the blood clumping together because of inflammation, which is there to heal the arteries. We're going to talk about that. Or blocking of the arteries can occur because the blood is thickening, and that again has to do with plaque. And so we're going to talk about that. So the high blood pressure is a warning sign. And so if you have the warning signs, do something about it. Nobody has a fire alarm go off and they just take the batteries out of the alarm and they go back to sleep, because the fire would continue to progress. So why are we doing that with our bodies? We just cover up the symptom with a medication, and we don't ever ask the question, how do I get my body healthier? And that's the sad reality. So we want to just use those warning signs for what they are. Stay as healthy as you can. If you have to use a drug or surgery to save your life or for those immediate moments, do that. But then work your tail off to get healthy so you can stay away from that. So now we look into circulation. So if you look here on this image, what you see on the top, that number A, is what they call a normal artery. So normally you're just going to have a round canal, nice and open. That's going to allow for blood to flow through it. And that's the way the artery should be. You look at letter B there, it says a narrowed artery. When you get inflammation, the outer layer of that artery starts to thicken up. Look how thick it is from that inflammation. It's very difficult to get fluid through there. The pressure is going to increase. So that can cause a rise in blood pressure. Then see what you look right there, that's totally occluded. That means it can't get through. So when somebody has a heart attack, or what they call a myocardial infarct, that's when you actually have the artery get so thick, or the outside of the artery gets so thick that blood can't get through it, and it blocks blood flow to a part of the heart, and the heart muscle actually dies. So that's what a heart attack would be. And then D right there is called an aneurysm. If the outer wall of the arteries gets weak, what can happen is essentially you get almost like, imagine if you've ever seen a basketball where somebody kicks a basketball and then the part of it just bubbles up, and you're like, well, that's abnormal. You get this like hump on top of the basketball and it just doesn't dribble right. Well, imagine that happening on your artery. If the lining of the artery gets weak from just constant inflammation, wear and tear, stress, you can get this bubbling, and that's where you can get this aneurysm, where the blood kind of like circulates differently. It's almost like if you see a creek and the water's flowing and it flows normal, but there's this little outlet to the side and it kind of pools or spins in a circle. That's where you can get an aneurysm. And a lot of that is from a weakness in the artery. Now, when you have that irritation, that aneurysm there, and you get irritation along the artery, your body will actually produce cholesterol to go and heal that area, and it will start to heal that tissue. If you get a lot of inflammation around there, you can get plaquing, and from that plaque, you can actually get the plaque to break off, and you can actually get a clot, like a thrombus, that will actually break off and block a smaller artery in your heart or in your lungs. That does happen, but it's really a symptom of your body being damaged and inflamed. Your body's trying to heal from that, and when you're trying to heal in an environment with a lot of inflammation, it just doesn't work very well. Okay, so we'll get into that with a little bit more detail too. So how does inflammation play a part? Inflammation is one of the things that's going to irritate the artery. So imagine those cell walls. So we just looked at the lining of the wall here. So look at letter A, that's a normal lining. Imagine someone just takes sandpaper and they're rubbing it on the wall of that artery. That's going to irritate it. That's going to cause irritation. Well, that would be what inflammation, essentially what inflammation is doing to the artery walls. And so what are things that play a part in inflammation? One is sugar intake. That's huge as far as a cause for inflammation. Two is the ratio of fats that you have. Your normal fats should be omega-3s to 6s. You should have about 2 omega-6s or 4 omega-6s for every 1 omega-3. That would be a more natural ratio of your healthy fats. If you get more of your conventionally raised meats, like let's say you get like grain-fed pigs or grain-fed cattle, they're going to be closer to 50 to 1, and the omega-6s are higher in inflammation. Omega-3s are lower. So the ratio is really off, so you're likely to have more inflammation in your body. 3 is acidity. We're going to talk through causes of acidity. And then lastly, free radicals as well. And that's just free radicals develop from just normal function of the body and cell use. And if we're not getting antioxidants in the body, free radicals actually cause aging and deterioration in the body. So there's Time Magazine said the secret killer. They talk about inflammation being linked to heart attacks and heart disease. And it really is. And so when we move forward, essential fatty acids, research shows that omega-3 acids are found to help stopping the buildup of plaque. So if you're getting a healthy ratio, you have the omega-6s, which you do need, but you also have a higher ratio of omega-3s, so you can prevent the buildup of plaque, which reduces heart disease and stroke. So fish oil helps with inflammation to clean out the arteries. Again, the ideal ratio is about 2 to 1 or 4 to 1. Rather than down there, that the normal ratio is closer to 50 to 1 when you're looking at most American diets. So that's wildly inflamed. So we really want to make sure that we're avoiding that. When we jump into healthy fats, so what are the fats that you want to eat so that you're having less of that inflammation? Olive oil, fish oil, coconut milk, coconut oil. Raw nuts is ideal, and then saturated fats like organic grass-fed meats. Your grass-fed free range is going to have a lot better fat ratio. That's the difference there. Your wild-caught fish, that's going to have a better fat ratio than your farmed. That's just how it's going to be. Your damaged fats, like your trans fats, canola oil, vegetable oil, commercialized meats, those are going to be really inflammatory, and they're going to really throw your ratios off. Yet they're super cheap, and they can sit on the shelf for a long time, so they're used in a lot of food, especially a lot of like fast foods, restaurants, and stuff that's sitting in box foods that can sit on a shelf for a long time. So that's why we find it so much in the American diet. So we really want to make sure that we're decreasing and avoiding those damaged fats, and you're increasing the healthy fats. That's a great way to take care of your heart. Now, remember we said heart disease is common. It's 1 out of 2 Americans, but it's not normal. I want to read something to you. So if we look here, we'll pull this up bigger. So this is Paul Dudley. So he's considered the father of American cardiology. So a pretty big deal, puts his face on the stamp, right? But here's what he says, quote, "See here, I began my practice as a cardiologist in 1920, and I never saw a myocardial infarct patient until 1928. So he never saw a heart attack for the first 8 years of practice. Back in my myocardial infarct-free days before 1920, the fats were butter and lard. And I think we could all benefit from that kind of diet that we had at the time when no one ever heard of the word corn oil," end quote. So he's basically saying that what was going on is people were eating different types of fats, and we weren't seeing heart disease. You think that guy understands the heart a little bit if he's considered the father of modern cardiology? I would think so, but it's so common for us now that we all have friends and family that have heart issues or have died from heart attacks. I know on my mom's side of the family, almost everybody, there's so many of them that have just died from heart disease. I mean, the running joke when I was growing up is mom was going to have a heart attack because everybody on her side of the family has heart disease. And when she started having issues with blood pressure and cholesterol, it wasn't a joke anymore. It started to get concerning. And now we've seen her really just start to live these 5 essentials well, where she's done so awesome, where her health is just phenomenal into her 60s, and she's just done great. And that's just because she's adopted a different way of living. So proud of you, Mom, if you're listening. So all that to say that heart disease is common, but not necessarily normal. And our lifestyle factors make a big part into that. So now we get into omega. So this is something, Optimal Omega. This is something I take every day. It's just a healthy version of fish oil, and it's going to get the ratio that we need. It's something my kids take as well, my family, and we just make it a part of our life. So if we want to have a system that produces health, this is just part of our system. It's not there to treat disease. It's there to promote health. But that's something that I strongly recommend making a regular part of your lifestyle if you're looking at supplements there. As we look at sources of acidity, so we talked about acidity can cause inflammation. So there's some major sources here. Conventional meat is going to be acidic because, again, the ratio of omega-6s to 3s is going to be off. Your deli meats and things like that are going to be much more acidic because of the preservatives that are in them. There's a lot of research as far as just like these deli meats being linked to like pancreatic cancer. Number 2, refined sugar and carbohydrates. Sugar is acidic. It destroys the immune system, and grain turns into sugar in the body. So your high diet in grains and sugar, you're going to ruin your acidity. And you think about what does America do? A lot of sugary foods, a lot of breads and grains. Most people, you talk to them, they say, well, I started cutting the sugar and the grains. I feel so much better. My joints feel better. I don't hurt. I've dropped weight. Life is just better. And this is a big reason why. And most people never regret that. If you've never done that, you might think it seems impossible, but I'm telling you, it's doable. Conventional dairy, when they pasteurize dairy, that's really hard on the actual milk of it and the dairy of it. So unpasteurized dairy can be really, really good for you, but you can't sell that in the grocery store. So conventional dairy is really hard. We've just, for the most part, eliminated dairy with the exception of like raw cheese. We do love that. So I hope I never get rid of that. I love that, but we don't do milk or anything like that. We just got rid of it. We do almond milk, and we do coconut milk, but we don't do just your regular dairy milk. And I've never regretted that. Joint health, gut health is all done so much better. Caffeine is very acidic. And it takes about 3 glasses of water, 3.5 glasses of water for every cup of coffee that you drink, just to balance the pH. So if you drink 1 cup of coffee a day, you need to drink about 4 cups of water just to get back to even. And then you should still drink your water throughout the day to stay hydrated. So and if you're a coffee drinker, you know caffeine is a diuretic, so it makes you urinate a lot. So normally you're not wanting to drink a lot of water after you drink caffeine. So just knowing that if you're doing that on a regular basis, you're likely having an effect on your pH and your acidity and usually your hydration levels. So making that a routine where you're maybe doing a couple of glasses a week of coffee is fine, but more than 1 cup a day is really excess. So if you can work down on that, you're better off. And then with coffee or caffeine, make sure it's organic because it's a highly sprayed product. Regular table salt, acidic. Sea salt is really good for you. Table salt is toxic. Don't do it. Alcohol is acidic. Tobacco, artificial sweeteners, and then medications as well. So these are major sources. And there's more for sure, but these are a lot of our major sources. So if you can look at those areas and say, okay, what's my system? Am I, of those 9 things, do I have 7 of them that I do on a regular basis? Oh boy, then I better reassess. Do I have 3? Okay, you're doing a little bit better. And then how can you just limit those? Like the way that you make changes isn't you don't do it perfect. You just focus on how can I limit those and just slowly work to get better and better and better. And then it's nice to have things like this where you can just reassess how am I doing or get re-reminded. Relearning stuff is actually really helpful. Sometimes we act like, oh, I know it, but relearning stuff is great because as we mature, our perspective changes. So be okay with relearning and hearing stuff more than once. So sources of acidity, that's a really good way. Start making changes there. You'll feel better. You'll be glad you did. Life goes so much smoother for you. As we look here again, what is your system? Again, that's the question. If you can take that away, what's the system you have? Are you happy with it? Do you need to change it? If you continue to focus on your system, you're going to have great outcomes. As we look here, just the Align Your Health book. So this is just a great resource that so many of the patients in our office have. Align Your Health is written by Dr. B.J. Hardick. But it's just got a great resource on the alkaline diet. So these are diets that are good for your pH. They're going to be easier on your heart. So sometimes you hear people talking about ketogenic, where it's like higher fats, low sugar, low grain. That tends to be better for your heart if you're getting good sources of food, because you can cheat on that stuff too. So just make sure you're actually getting nutrients and high quality. But that's a great resource. If you're looking for a place to start as far as nutrition goes, the Align Your Health book is a great resource that we like. Again, we talk about free radicals. So anytime we have chemical reactions, our body produces free radicals. It's kind of like if you have a bonfire, there's smoke. Smoke is the free radicals of chemical reactions. So everyone's going to have them in their body. The more we have, the faster we age. It speeds up the aging process. It's harder on our bodies, our cells, our organs. So when we have things like antioxidants, we can decrease the amount of free radicals and how they're affecting us. So fruits and vegetables are full of antioxidants. They prevent our cells from being so irritated by the free radicals. So antioxidants will do that. So fruits and vegetables. One thing that causes free radicals is toxicity. So if you haven't done things to help detox, like things like sweating, drinking a lot of water, those definitely help. Breathing heavy helps big time. Saunas will help you with toxicity. We do a thing called the detox system in our office. That's really good at helping pull toxins out of your cells and helping your body excrete it naturally and safely. So that's a great way to go too. If you haven't done a detox in a while, the detox system is really good with that, but that'll help with free radicals and just overall health. Then we jump in here. We look at the max greens. If you're a person that struggles to get vegetables into your diet, you're just not going to get as many nutrients, and that's going to be the antioxidants, but the nutrients that your cells need to thrive. Max greens is something that we use in our house all the time. We'll take a scoop of that, put it in almond milk, and we'll blend it up. And the kids get to drink it, and they think it's a milkshake. If you ever hear my kids talk about a milkshake, that's what they're having. They're having greens and almond milk. And then for me, I put it in a smoothie every day. About 1 scoop of that is equivalent to about 3 servings of vegetables. So if I do a scoop of that with some spinach, I'm getting 4 or 5 servings of vegetables right off the bat in one smoothie. So that's a great way that you actually can get those foods in your diet on a more regular basis. Probiotics and prebiotics are in this product, which is great because that's awesome for gut health. If you're trying to have a healthy gut or heal your gut, that's really good. So for me, I struggled with gut health just being on antibiotics for so many years. I was on the antibiotics for 8 straight years. They put me on it for acne, and I at the time didn't know it ruins your gut. And it's terrible for your immune system. So I have to do a lot to take care of my gut. If you're like that, this is a good product to use on a regular basis because of the prebiotics and probiotics. So I really like that one as well. 4 steps to improve your diet. Number 1, reduce sugar intake. So just stop eating it. How do you stop eating sugar? You just stop. Like sometimes people always want the strategy. Oh, how do I do this? Just stop doing it. And then track it. Did I eat sugar today? How much did I eat? Just like sometimes we overthink it because we don't want to make change. If you want to start making sweets or desserts or things like that, stevia and xylitol are really good ways to start cooking and making snacks and treats because you don't have to be so disciplined that you never enjoy life. But those are great ways to make treats that taste really good. If you need recipes, talk to the team in the office. We can help you. Changing your fats, getting from your damaged fats like your canola oils and your vegetable oils into your healthier fats are going to make a world of a difference. Changing your meats over. If you're going to make a big change with your budget as far as your grocery list goes, getting healthy meats, that's the best place to start. And then if you're looking at fruits and vegetables, the clean 15 versus the dirty dozen. If you don't know what that is, you're by a computer, Google it, the clean 15 and the dirty dozen. The dirty dozen are the things that will absorb more toxins, so you're going to get them in your body faster. The clean 15 are things that tend to have better protective shells, so any pesticides or chemicals that are on the food tend not to get into your body, so you can have those more conventional. You don't have to spend more on those types of products. So a really easy way to just focus on your budget as far as when you're meal prepping and planning for your week. Eating vegetables, number 4, eat vegetables, fruits and vegetables for sure, but eating vegetables, shoot for 3 to 5 servings a day. If you got 1 vegetable a meal, you'd be doing really, really well. If that was your habit and that was your system, I always eat 1 vegetable at every meal. I promise you your body would thank you for it. And once you started doing it, it would get a lot easier for you. Variations in blood sugar levels. This is really important when it comes to neurology. So when you eat a bad meal, for example, so what you see here is on this red line. So they're saying, let's say an example of how your day goes when you eat a poor breakfast. Let's say for breakfast you eat cereal or you eat pancakes or you eat something that's high in sugar. What you see in the bottom corner right there, the bottom left corner of that first triangle is where your blood sugar levels would be when you first wake up. And then it spikes into that peak, like the mountain peak where it's too high. Now your nervous system freaks out. So it stresses your body. You release cortisol. You start to bring down the blood sugar so that you don't go into a coma. The blood sugar starts to drop, but then it drops faster than it should. And then you get below normal. Now you feel fatigued. You're tired. You're not as effective. You don't think as clear. You need a snack. You need a treat. You need something to drink, something to eat. And so you go to Starbucks, eat a snack, whatever it is. And then it starts to spike things again. Things get too high, and then you just go up and down. That is really stressful on your hormones. It's really stressful on your nervous system. If you eat a good breakfast that would have protein and fat in it and nutrients, your blood sugar levels will be like this green line. It just slowly goes up, and then it just maintains really well. That's a lot easier on your body. It's a lot easier on your hormones. It's a lot easier on your nervous system. And that person's going to have a better outcome. It's not as hard or stressful on your heart or your body. So ideally, your breakfast has a really good protein and a good fat. That's how you're going to have a better outcome that way. Good protein, good fat. Now, what does that mean to your nervous system? So your nervous system is going to go one of two ways. You're going to go into a sympathetic state, which is stress. So that's on the left there. Sympathetic nervous system, that's fight or flight, and you're going to burn out hormones. Or you're going to go into a parasympathetic state, which is rest and digest, and that's going to balance hormones. That's relaxed, that's healing, that's thinking clearly. When you're creative in thought and you can really like think up stuff and put things together, that's usually when you're relaxed, and that's parasympathetic, and your hormones are calm. When you're stressed out and you're making bad decisions and you feel like you just don't have enough time, that's sympathetic. That's hard on the nervous system. That's hard on the heart. So we go back to that. If you think about that image we had of the arteries where they expand and contract, when your body is stressed out, those arteries will tighten down to increase blood pressure. And when you're relaxed, they calm down. If you're constantly under stress, they stay tight, and that wears on the muscles of the arteries, and you're more likely to get that pooling later on because the arteries get weak. You're going to develop disease faster if you stay in a sympathetic state because your body doesn't recover or heal properly. So that can be very, very hard on your heart. And so we want to make sure that we're approaching the nervous system right, that we're taking care of our body the right way, because that's going to lead to a better and healthier heart. Now, when we look here on chiropractic and blood pressure, so one of the essentials we talked about is core chiropractic. Well, what does that have to do with heart health? So I thought this was really interesting. So in 2007, researchers at the University of Chicago evaluated a single adjustment at the top of the spine. That's the atlas bone. So if you feel right at the base of your skull, so imagine you're feeling right at the base of your skull right here, that's your atlas bone. So these doctors of chiropractic basically looked at these people and they said, all the patients in the study had high blood pressure and they had abnormalities in that area of the spine of that vertebrae. The patient's blood pressure was checked. So they gave them an adjustment. The blood pressure was checked after the adjustment, and then eight weeks later. The results were that the blood pressure reduction was similar to that what you would see in 2 blood pressure medications. So this was a big study because one of the main doctors was a well-known medical doctor that wasn't a huge fan of chiropractors. And they did this study and he didn't believe it. But I mean, then they did it again just to confirm it. And then think, holy cow, how on the earth does adjusting the spine affect the blood pressure? And for a long time, people started then rushing into chiropractors thinking, oh, if I go to the chiropractor, it's going to lower my blood pressure. That's not totally true. So don't believe that. Okay. The study is accurate, but just because you get adjusted doesn't mean your blood pressure goes down. So I want to read you another study. So here's another study in 2012. They monitored the same area of the spine, but in this group of people, their blood pressure was low. And so they adjusted these patients and their blood pressure went up. And so 2 different studies, the same thing, patients with high blood pressure or low blood pressure and issues with their neck, they adjust them and the blood pressure goes down and goes up. And so that can be confusing. So what does the adjustment do? Does it raise blood pressure? Does it lower blood pressure? And the answer is it doesn't do either. The adjustment helps the nervous system work better. And really the best research, some of the best research in the world is done by Dr. Heidi Havoc and her group out of New Zealand, where they're showing it helps to support more normal brain function. But the adjustment is improving brain function. And if the brain works better, the body's going to work more calmly and it's going to be healthier. And if your blood pressure is too high, it can help bring it down because you're healthier. Or if it's too low, it can help bring it up, but it doesn't actually treat the problem. It just helps the person stay healthier. So it's just kind of cool to see that the adjustment has a direct effect. And we know that this base of the spine here is what they call the brainstem. It controls things like heart rate, breathing rate, sleep cycles, hormone release. And the better that does, the healthier your heart can be. But it's really because the nervous system, if it's healthy, that you're going to have healthier organ systems. But I thought that was really cool to see just how chiropractic has affected the heart. So it does have an effect on the heart. Now we look here, so we say, well, what is health? So this is just always a good question, going back to what's the whole point of us doing this? You're not here because you say, I want the healthiest heart in the world. You want great health, and that means you need to have a great system. So what is health? Health is function. If you're in our office, you've heard me say it. It's all about functioning and healing at your best. And so if we condense it down to make it useful, health is all about function. If your body functions right, you stay healthy. So then what controls all function in your body? It's your nervous system. The way that you're created is that your brain and nervous system controls how you function. Your brain sends life messages down the spine and out the nerves. It tells your heart to beat, your lungs to breathe, and your body to heal. And so if health is about function and your brain and nervous system control function, then what system can you take care of and maintain to support optimal health? Think about it. What's the system Obviously, the brain and the nervous system. So if I want to have great health, or I want my kids to have great health, I want taking care of their nervous system to be a part of their care. If I want my mom to stay off of her blood pressure and cholesterol medications, I want taking care of her nervous system to be a part of her care and be a major system that she's taking care of to stay healthy. And the reality is some of the most educated people in the world are starting to figure this out as well. And so if you look here, and I'm going to explain to you why. If you look here on this chart, what you see is in the image in the middle is a normal curve in the neck, and that white cord coming down there, it looks like a piece of string cheese that's bent. That's the spinal cord. When you have a normal curve in your neck, the spinal cord sits relaxed with no tension. And it goes down into the rest of your body, but going up, you can actually see the brain in that middle picture, okay? And so when you have a normal curve in your neck, the spinal cord sits relaxed and there's not tension at the very top part of the brainstem up there. So the spinal, you're seeing the neck from the side, normal curve, and then you're seeing right at the top, how is that tension there? There's plenty of room for cerebral spinal fluid, or the fluid that nourishes your brain. Now you look to the image on the right, and what you see is the spine is completely straight, and that little piece of string cheese thing looking there, that's your spinal cord, that's nice and straight. But at the very top, you see where it's actually, the bone there is basically touching that tissue. And here's what happens there. If you take your hand and you make a C shape like this, when you have a normal curve in your neck, your spine sits in a curve and the spinal cord sits relaxed just like the skin on your palm. And that's what you saw in that first image, or that middle image, is the spinal cord actually sits relaxed. There's no tension. And that means there's no tension on the spinal cord pulling at the brainstem. So it's going to be less pressure and tension on the brainstem, better fluid and circulation around the brainstem. Now, if you take your hand and you straighten it out, so let's say we take our hand and we let me get this here. So we take our hand and we straighten it out. What happens is the skin on your palm goes from wrinkled and relaxed. As you straighten it, it starts to stretch and pull, and you get tension. Now imagine bending your fingers backwards, you get more tension. When you look here and you see the spinal cord, when there's a normal curve, there's not much tension on the spinal cord. When you lose the curve, there's a lot of tension, and that can actually put pressure right up in here in the brainstem, and that's where people can start to get misalignments or start to have issues with spinal fluid flow. And if you can relieve that pressure, we can see a better function of the brainstem and the nervous system, and that's where they're seeing some of those outcomes with the studies and the tests, where they're saying, hey, this actually, we saw it help with blood pressure here, or help with blood pressure here. And it really comes down to a healthier nervous system is just going to have a healthier body. So if we take care of the nervous system, that's a system that you can use for great health. And so we want to just continue to prioritize that, or for me anyways, if I want to have great health and more predictable health, then I want to prioritize that. So hopefully that makes sense. Healthy curve, healthy nerves. Straight spine, not so healthy on the nerves, which means if the nerves run your organs are less likely to do as well. They're going to age faster. Okay, so that's what we see there. That's normal. And this is what some of the best doctors in the world have to say about this. So coming back to, this is Dr. Jack Wolfson. He's considered by many one of the best cardiologists in the world. And he says this is written in he wrote it in his book. He thinks it's that important. Quote, every cardiovascular problem can be improved with chiropractic care. If you care about your health, chiropractic care is not an option. It is a necessity. That's what he put in his book called The Paleocardiologist. Just phenomenal stuff that he would even write that, but he makes it a priority. He doesn't just say this stuff. He absolutely believes it. And so this is his book, The Paleocardiologist. If you have specific questions on certain types of heart issues, he's written on it. And so I'm not a cardiologist. I don't want to sit here online and answer everything about every heart disease, but he walks through in his book and says 90% of what people are doing for heart health is garbage. You shouldn't be doing it. And he very strongly says why, and then areas as far as how you can approach that. So that's a great resource. If you're looking for a good book to read, that's a good one to read. But the other thing is this, is if you listen to him lecture, now, he's got a clinic outside of Phoenix, Arizona, and he gets people that fly in from all over the world and come all over to see him to get well. And what he says is this when he lectures: if you have someone come in and start care with me, this is what he says: if they don't start chiropractic care within the first couple of months, I will discontinue them as a patient. I will dismiss them as a patient, because I'm not going to see the same results in their outcomes if they don't have a healthy nervous system. And I remember the first time he told me that, I was listening to him at a seminar in Las Vegas, and he had said that, and my jaw dropped, and I was like, holy cow, can I record this thing? And here's the cardiologist saying, the heart doctor saying, if you want to have healthy organs, you've got to have a healthy nervous system. And he absolutely lives it. He's just very much direct and in your face, but man, does he get good results. And so if you want to learn more from somebody like him, this is a great book. I know he's got different resources online as well, but really, really cool to see. So now we come back to the original question. What is your system? What are you doing to produce health in your body, and how are you going to approach it? And the reality is health is one of the greatest gifts that God gave you, but you're responsible for it. And if you want to have good heart health, yes, in crisis, use the hospitals, use them for the heart surgeries, use them for the bypasses, use them for the medications if you need to once you get to crisis. But what if you just don't want to end up there? And then create a system and focus on a system that's going to produce health. And the best system that I know about is the 5 essentials. That's why I teach it, but not just teach it. That's why we strive to live it every day in our family, that we continue to refocus. How are we doing? How are we doing? How are we doing? Because if we want to have great outcomes, we've got to have a system that we can use, that we can have for accountability, that we can follow up on, that we can dive in deeper on, and that we can continue to advance with. And so hopefully you can use those 5 essentials too to produce the outcome that you really want. And that's really the goal. The goal of this is to get you to think that way and really just take some time and reflect and then apply it to your health. And so hopefully that's useful. If you've got questions, for sure, talk to me in the office, let me know. But the reason we're doing a lot of these webinars is that, yes, we can't get together in a group just yet. We're getting close. But we want to continue to bless you and encourage you to live a great life and to just live in alignment with God's design for your health. And so hopefully you can use these events to do that and just to have great health. And so have a great night, everybody. Enjoy the weather. Get out, be active, take care of your heart, eat well, and just love the people you're close to. All right. Bye.